So the increase in cases that we're currently seeing with the Omicron variant is not unexpected. What is reassuring is that although we're experiencing a high volume of cases at the moment, we are not seeing the exponential growth that other European countries and the UK have seen. This is down to a combination of factors. This is around the successful booster campaign, our significant promotion of testing and behavioural change, and linking that into people reducing the amount of mixing they've got and firmly linking into confirmatory laboratory testing and contact tracing. We are actively planning to reduce the self-isolation period from 10 days to 7 days. This is with conditions, though, and this has been as a result of me being in contact with the modellers in the UK, looking at the assumptions that underpin their model to enable us to do this safely and keep the case numbers as low as we can. So those conditions are that people need to be asymptomatic, they need to lateral flow test on day 6, stay in self-isolation, lateral flow test on day 7, at least 24 hours after their first test. If they're negative, they can then come out of self-isolation. This is for cases. The reason we haven't launched it already is I'm actively working to look at expanding access to lateral flow capacity. So we're not putting all those extra cases through the drive-through site so that we can cope with the increased volume of lateral flow testing that will result as a result of this policy change.
So do we have a timeline or as to when we can expect that to happen?
I am hopeful that will be able to implement by the end of this week. I can't give you absolute guarantees around that. Others are leading on this piece of work and engaged in those discussions. But we're sort of cautiously optimistic that we will be able to make that policy change by the end of this week.
As regards lateral flow tests themselves, you said earlier in this interview that you're looking at increasing the availability of them. How will you be doing this? Because there has been some debate over the last few days about their availability in Gibraltar.
Absolutely. One of the things that my public health advice is around maintaining that model of supervised lateral flow testing. There are 5 reasons why I would recommend this. Firstly, around the quality of the tests. You may have seen in the media last week, it was reported that a UK manufacturer had failed a lot of quality standards and a lot of their tests were therefore not allowed to come onto market. Secondly, quality of testing technique. Thirdly, that we link into laboratory confirmation for PCR testing. This is important because that then enables us to do ongoing genomic sequencing to understand what variants we do have circulating. Fourthly, link into contact tracing bureau and contact tracing. And finally, the 5th one is around, it gives me insight as a result of that contact tracing into the epidemiology so I can tailor specific public health advice to Gibraltar. Absolutely take on board people's reflections around access and ease of access to lateral flow testing. Those discussions are ongoing this week in terms of adopting a range of providers who are able to do that supervised lateral flow testing. I can't give you the details of who they are yet because those discussions are ongoing.
But can you perhaps elaborate on whether we're talking about perhaps pharmacies or local private clinics or...
Potentially, yes. Yeah, absolutely, potentially, yes. So range, because from a public health perspective, my advice into that process, so I am not directly involved in awarding of those contracts, but my public health advice is they have to assure me that they are trained and supervised lateral flow testing, that they absolutely can guarantee me how many tests they are doing, so we keep a handle on the numbers, and that of the positive tests, they link firmly into laboratory and contact tracing systems. So it is those safeguards from a public health perspective that I am requiring of those broadening of providers to provide those lateral flow tests.